Let's today talk about why it is important to undergo a training for learning phacoemulsification surgery and what are the things that we should keep in mind when we learn phacoemulsification surgery. Hello everybody, I am Dr. Mohita Sharma, Senior Eye Surgeon and Phaco Specialist at Tirupati Eye Center, which is an eye hospital in Sector 33, Noida, India. As ophthalmologists, we all are surgeons, and in eye, the commonest surgery today is phacoemulsification. So it is important that each one of us should know how to do a good phacoemulsification surgery. Unfortunately, some of us do not get an opportunity to learn, and some of us, even if we get an opportunity, do not reach up to perfection because we do not learn how to refine each step of surgery. It is important to be perfect when we do a phacoemulsification surgery because only when we reach perfection, surgery actually becomes a pleasure and it becomes an art and it becomes a passion. And that's the stage which we all should reach. So while learning phacoemulsification surgery, there are a few things that we need to keep in mind. The first thing is that we should, even before we start, we should know our machine. Whichever phacoemulsification machine we are using, we should understand each feature of the machine. There may be venturi machines, there may be peristaltic machines, or there may be machines which are actually venturi, but you can control the speed at which the surgery is happening. So you can start with a slower speed which mimics a peristaltic mode, and then you can go on to the moderate speed and then to a faster speed. Similarly, there may be various modes in the machine. There may be a multi-burst mode, there may be a wavefront technology, etc., etc. There may be trilinear mode, there may be a bilinear mode, and if you understand all those modes, at least theoretically, then you would know how your machine is functioning and what you have to do while you are actually doing it practically. Similarly, not just the phaco machine, you have to understand your phaco tip and the phaco tubings also. There may be tips which are for 2.8 mm incision, tips for 2.2, tips for 1.8. You have to understand if it's a 1.8, it may be a microflow needle with a very narrow lumen so that you can actually operate at high vacuum also. But then if you are operating on a hard cataract, that narrow lumen should be combined with a flare in the tip so that you are able to cut also better. And sometimes these flared tips may have micro grooves. This allows more fluid to go inside, so your fluidics are better and your chamber is rock hard. Similarly, there may be different tubings, there may be high vacuum tubings, there may be lower vacuum tubings, so you need to understand all the functions that are there in your machine. Once you have understood your machine, the next step is you go on to surgeries. When you go on to surgeries, you have to learn how to refine each step. Now, there is a big question on how many surgeries we should do to learn a good phacoemulsification. My answer is that the number of surgeries is not important at all. What is important is that you refine each step. For example, if you're making an incision, then what should be the configuration of the incision? Should it be rectangular? Should it be a square incision? And how much should be the size? Because we don't want it to leak. We don't want it to be a tight incision. If it's too large an incision, it would leak. If it is too small an incision, then it can cause corneal burns. So our incision should be ideal. And when our incisions are ideal, the whole surgery is going to be good. Secondly, for example, coming to the second step, that is rhexis. Now, if it is a runaway rhexis, how do you manage it? If it's an intumescent cataract, how do you do a rhexis? Rhexis is again a very important step. The size of the rhexis is important. And thirdly, when you come to actual trenching, what are the techniques that you should use? You have to learn all types of techniques, whether it's divide and conquer, it's stop and chop, and it is chop. Because actually, when we start doing a surgery, we do a mix of all these techniques, and we do a mix in such a way that we are making it a safe surgery. For example, central chop may be safer than a peripheral chop, safer for your rhexis, safer for your posterior capsule. So you have to learn how to refine each step, which is important. And as I said, the third point is that numbers is not important. What is important is that your each step should be well done. Because once you have a complication, your confidence comes down to very low levels, and then you have to again revive it back and come back into full form. Even a good surgeon, once they have a complication, their confidence also comes down to some level. So it is important that you should do your surgeries in a safe manner so that your confidence goes on building to higher and higher levels, and you are able to actually reach the level what you want. The fourth important thing is you should observe more surgeons. You should observe as many surgeons as you can, and even the junior surgeons, even your colleagues who may be learning, because from there you will learn how, not just refinement of steps but also complication management. And if you have once seen how a complication is managed, even if you don't do it yourself, later if you encounter that complication, you know how to deal with it and you know what to do about it. So it is important that observation should be a part of learning. The next important point is that apart from this observation, you should also know which case to take up when. You should always start your basic learning first with ideal cases and then slowly graduate to the more advanced cases and to difficult cases. But yes, when you learn phacoemulsification, it is important to learn not just the ideal cataracts, but it is important to learn how to operate difficult cases also, whether it is a hard cataract, whether it is a small pupil, but it has to be in a gradual manner. Initially you can go in for a basic course, you can give a break, or if you don't have time, don't give break, you give a break, and you can then graduate to the difficult cases also. So the next important thing while you are learning, apart from basic to difficult cases, is that some people have had a break in their life, in their surgical career. You have to remember that surgery learning is just like when you learn cycling. If you learn it once, you never forget. Similarly for surgery, once you have learned a surgery, you never forget. Your confidence may be a little low if you have a break, but once you start doing again with a few cases, and you can actually go for a training course, build up your confidence, and then go full-fledged into your professional career. So these were some of the points which I feel have to be kept in mind when you are undergoing a surgical training course. And of course, whenever you start learning anything, you go back to your student life. So it's college days again, it's your student life back again. You meet new people, you meet new mentors many times, you make new friends amongst your colleagues who become your support system for throughout life, whether they are colleagues or your mentors, and you see a new place. You may visit a new place and you may see a new culture. So these are all the advantages that you get, which are accessory benefits whenever you decide to upgrade your surgical skills. So this was all the information about what you should do when you start learning phacoemulsification surgeries. At Tirupati Eye Center, we are offering a phacoemulsification training course, the details of which you can get from the description that is given below. Thank you so much, and see you again soon.